The Department of Public Health and Human Services is pleased to bring you Aging Horizons. Medicare, Medicaid, Social Security, fraud, legal issues, veterans benefits, and caregiving. Aging Horizons is a program dedicated to inform and prepare Montanans on these timely issues, making a difference to you and your loved ones. Here now is today's program host.
Well, Happy New Year and welcome to Aging Horizons. Today we'll be talking about Medicare Advantage. You know, the deadline came up on December 7th to make some choices on Medicare. Well, we're now into the 2022 year and we want to review some of those choices that you did. What do you want to keep an eye out for? What do you think you got versus what you actually got? We'll talk about that and so much more. Stay tuned.
This is Bill. He just received his new Medicare card and is following some simple rules to protect himself from fraud. He knows to never give out his Medicare, Social Security, or bank number over the phone. And this is Nancy. She knows that to detect any problems, she always reads her Medicare Summary Notice or Medicare Advantage EOB to make sure the billing is correct. Both Bill and Nancy know that anything suspicious can be reported to Montana SMP at 1-800-551-3191.
You mean I can get help paying my prescription drug premiums?
Let me get this straight. I could be eligible for help with my family's prescription premiums even though I own my own home?
And our assets won't be counted.
If you're a Montana resident enrolled in the Medicare prescription drug program, you could be eligible for help paying your premiums. Call or visit the Big Sky RX website today to find out, even if you think you're over income.
What do you know about that? I'm eligible.
Providing long-term care for someone in need is a labor of love, but it is a labor. Time apart is healthy and necessary both for the caregiver and the person receiving care. It allows each a respite, time to relax and recharge. If you're a long-term caregiver, visit the new Lifespan Respite website. Financial assistance may be available. Respite for caregivers. It's okay to need it. It's okay to want it. It's okay to get it.
I have a complete new respect for the Delta. Everyone is going to be exposed to the Delta. This is not the virus that we saw in the beginning of the pandemic. This is so much more dangerous, so much more communicable. People get sicker quicker. Now the question is do we want to have a barrier of protection, of antibody protection via the vaccine? Or do you want to just go at it by yourself? The hospitals are full of people that are unvaccinated and they are just not full of people that have had the vaccine. The goal is to prevent people from getting hospitalized and dying, and that's exactly what the vaccine is doing.
Hi folks, and welcome to Aging Horizons, brought to you by the Department of Public Health and Human Services. I'm your host, Brian Lamore. And we're talking today about Medicare. We've come into our new year, January 1st. We've chosen a new maybe Part C plan, Medicare Advantage, and we want to evaluate what it's doing. You did receive in the mail this book at one time, Medicare and You. It's got all kinds of information. You should have it around the house somewhere because it'll answer a lot of your questions. Joining us again is Kimmy Everman, your Communications Outreach and Specialist with DPHHS. Yes. Welcome to your show.
Thank
I always
you.
like to say that.
I love when you say that, Brian. It's always so good to have you here.
Well, thank you.
So good.
Well, you know, we've got a new year. We've got our new Medicare plan, or maybe we stayed with our Medicare plan. We decided that choice. What are some of the considerations to make sure now that we're getting what we thought we were getting?
Well, you know, for one thing, the open enrollment for the drug plans and such was last December, or in December. It ended in the 7th. And, you know, so between then and now, hopefully you've gotten information from the company that you chose to be either your Part D provider, which is the medications, or a Medicare Advantage plan, Part C as you called it, or even the traditional Medicare A and B. Are you getting billed correctly? Do you have, you know, if you're in a new drug plan, did you get your card or did you get information about it? You know, things change so quickly and there's so much stuff people get in the mail that they really want to watch for whatever they chose, whichever company they chose, watch for any information coming in, especially in January, because then you can start kind of building your year. And the reason I say that, Brian, is that Medicare beneficiaries know that every every year they get to choose some different stuff for their coverage, different parts of their coverage. And it can be a very stressful time for people, very, very stressful. And so what you do starting in January is, instead of trying to remember it when you're choosing, the following December, keep a little health diary. Was the company helpful when you couldn't get what you needed? Or is the company paying for what they said they'd pay for? I mean, January is pretty early, so you might not have lots to go on, but that's where you start. So you don't have to try to drag it from your memory in the summertime.
Right. And Kimmy, 1-2 years ago, we got new Medicare cards with a different number. Now, if we changed our plan, or if we continued with our plan, do we get a new card with a new number?
That I don't know. You should talk to, if you go, for instance, let's say that you got a Medicare Advantage plan, say from Humana, let's just say. They probably change their cards every year. However, if you don't get one and you think you should have, you need to call their customer service line and ask. And then to just take one step back, as far as that new Medicare card that we were talking about, it doesn't matter what plan you're in, that will always be the same. You won't get a new one of those every year unless you lose it or something happens. But that's going to always reflect that you are a Medicare beneficiary, that you deserve whatever benefits are there that you're eligible for. Another thing in January that I like to talk about is, were you eligible for any helping programs? And we'll talk more about the helping programs a little bit later, but that can help put money back in your pocket if you're eligible. And the good thing about the Medicare helping plans is you don't have to sign up during an open enrollment or anything like that.
It's never too late.
It's never too late. And then finally, I want to mention the general enrollment period. And that is also going on right now from January 1st to March 31st. And Brian, that's important. Let's say that you are a 69-year-old person who does not have health coverage from their employer, and they didn't take Medicare, and they have no coverage. The general enrollment period is for them, if they've decided that they want to come into Medicare at that point, to sign up. And I want to just mention that if that is your situation, you may have penalty to pay, and I would say go to your SHIP counselor. We'll put their number up on the screen. Go to your SHIP counselor and talk to them about the general enrollment. And then the other thing about general enrollment is that your benefits then start July 1st. So you must sign up if you haven't, and general enrollment is really, you didn't sign up for Medicare when you were eligible, and you didn't have any existing care that was as good as or better than Medicare. So I think if that's you might want to reach out to a SHIP counselor. Find out, is there anything you can do about getting that done? Because we want all folks over 65 or, if they're disabled, to get Medicare.
Get their adequate benefits. And you can kind of quickly go over what the SHIP counselor will do for you once you contact them?
Sure, they're going to talk to you about your situation. They'll probably ask you about your financial situation. Well, that's because they want to help you if you're eligible for some kind of a helping program. Call it a hand up, not a handout. And also want to make sure folks know that if they ask you that sort of thing, it's completely confidential. They're not talking to your neighbors or anybody at the cafe or even their coworkers about you. So you can tell them that information and feel very secure.
Very secure, that it's safe and informative. That's the important part.
And they will help you through the process. They'll help you understand what the process is and then help you get through whatever you need help with.
And if you're eligible for a helping program, they'll help you with that, plus other programs that are available through your area agency on aging. Stay tuned. We'll be right back.
I was outside working on some equipment, nothing too strenuous. I started sweating and feeling out of breath. When he felt pressure in his chest and aching in his arms, I knew we had to call 911.
First responders were there before we knew it. 38 minutes later, the doctors had restored the blood flow to my heart.
Now we know dialing 911 saved his life.
Your life is on the line.
This message sponsored by Mission Lifeline Montana.
When I first got here, I was struggling. No money, sleeping on the living room floor of a friend's apartment.
Diana Johnson, Energy Share Coordinator.
I know what it's like to need a hand. Now that I work with Energy Share, I help people pay their winter heating bills. I don't care if you're a veteran, a senior citizen, have a family, or are single. Energy Share is here to help.
If you need help paying your power bills, call or visit Energy Share, helping Montana families get through the winter since 1984.
Out here, we love our animals, from the wildlife to the livestock. Inside, it's the same. They're just like family. We keep them happy and healthy, most of the time. Secondhand smoke puts pets at risk for cancer, feline lymphoma, vomiting, increases the risk of tumors and lung cancer, even causes eye and skin disease. Secondhand smoke puts your pet's life at risk.
I think the most pleasant surprise when we turned 65 and signed up for Medicare Part B was finding out about our Welcome to Medicare preventive visit.
It was free, and it gave us the opportunity to visit with our doctors and establish a plan for our health going forward.
They reviewed our medical history, measured our height, weight, blood pressure, and counseled us on other risk factors.
To learn more about Medicare's free or low-cost preventive and wellness benefits, call your local SHIP counselor at 800-551-3191. I mentioned it's free, right?
Twice.
Welcome back to Aging Horizons. We're talking about Medicare, and you got this book about, several months ago, let's say last year. And it was designed to help you choose a plan or understand Medicare and answer a lot of your questions. And the question answerer person here is Kimmy Everman. Let's start at the top. We have some helping programs that are available to Montanans. There's a variety of them. They have different eligibility. Tell us more. What do they provide, and maybe a general eligibility info?
Well, there's 3 or 4 programs that are just stellar. And we're going to start out with one that's called MSP, that's the acronym, and it's just the Medicare Savings Program. And what MSP does is pays for your Part B expenses, deductibles and premiums, that sort of thing. There's several levels of assistance, so even if you make a bit more, you may still get some of that assistance. Or if you are a person who's less financially stable or able, you may get the top eligibility that comes with everything. And it's very helpful for the Part B out-of-pocket expenses especially, and just knowing that you can go to the doctor, because Part B, let's just remember, Part B is going to the doctor once a month or whatever, and having it there for a person with a little bit of help around it can be very, very, I think, validating to whatever it is that their conditions are, and that they need to see the doc and that they don't have to pay so much out of pocket. So that's Part B. Then we have a couple of programs for Part D, and I think we remember Part D is the RX, or the prescription drug coverage for Medicare beneficiaries. The first is called Low Income Subsidy, LIS, or Extra Help. It's under any of those 3 names. And what it does is, like the MSP for Part B, it pays for a bunch of things in Part D, so that perhaps you can get the premium for your drug plan paid each month, or maybe you're getting lower at the pharmacy counter costs because you're on that program. But you need to look into that to see, if you do, if you are eligible, because it won't just happen automatically. And then there's also Big Sky RX. And that also goes along with Part D. And Big Sky RX we absolutely love, because it's a homegrown Montana program. It is not as stringent eligibility-wise as some of the other programs out there. So more people can get that help. And what the Big Sky RX does, it's very simple. It pays the premium each month up to a certain amount of money.
Yeah.
And for so many of our folks who say to a SHIP counselor, but I don't take medication. Why should I have to pay for a medication plan? Well, something like Big Sky RX is perfect for you because it pays the premium of your placeholder plan. Then you don't have issues getting in later or any kind of penalties to pay or anything like that. And then finally, we have a dual eligibility, which is you're a Medicare and a Medicaid recipient. And under the Medicaid, you get all of the kinds of help that we were just talking about. And you need to be a fairly low-income person for that.
Right.
Now, all those things sound great. How do I get it?
Yes.
Yeah, you call a SHIP counselor.
Yes.
And we're going to put that number up because a SHIP counselor can help you chat with you a little bit, hear what you have to say, hear what you need, and then including the sort of Medicare help, they might know of something else that you could be eligible for, meals or transportation or respite or so many things, so many services that folks at times feel, I don't know what to do. They don't know who to reach out to. And I think that's one of the great things about talking to a SHIP counselor is they're not only going to help you with the Medicare, but they're going to listen to what else you might need. And even if that's not what you called about, they're going to offer information to you to help you know it's there if you're eligible and you want it.
There used to be a term we used, one-stop shopping.
Absolutely.
And that's what we have with our area agencies on aging. We have experts in Medicare and, well, Medicaid too, if you need a little bit of help there, but all programs offered through your area agency on aging.
Absolutely, and I can't stress enough that people should just give a call. Again, hand up, not hand out. Give a call. They can get you the information that you need, and if you're going to be eligible for anything, then get it, because you've done a lot for your community and your family all these years. You deserve to have a little bit of assistance if you need it.
Oh yeah, well there's a lot of outreach for veterans benefits. You're a senior, these are senior benefits.
Right.
I'll say there's no difference to your entitlement to them because you have participated and you have contributed to your community.
Absolutely.
And look at your paycheck. I mean, there's a little thing there that says Medicare, so you pay a little bit all the way along the way to help everybody else, to make sure we have a good health care system addressing senior needs. Well, now we're drawn to a close on our second segment here pretty quick, but I'd like to reiterate how important the SHIP counselors are to our area agencies on aging and seniors throughout the state of Montana. We have one telephone number and it'll call in to your local area. So you're not talking to someone across the state who might have different ideas of what it is to be a senior. You might know the person, but the confidentiality is very important with our system. They don't tell anybody else. They don't have anything on the shelf to sell you. They're only interested in you getting the adequate product that you want, and you're the one who decides, not them. Got a lot more information. Stay tuned. We'll be right back.
Every 65 seconds, someone is affected with Alzheimer's or other dementias. Many become isolated at a time when help is most needed. If you or someone you love is affected, help is available, both for people with memory loss and their caregivers. Memory loss can feel frightening, but you are not alone. Call the free 24/7 Alzheimer's Association helpline, 800-272-3900, for guidance and support.
Elder abuse is a growing problem, and it's happening right here in our Montana communities. At least 1 in 10 older adults are victims of physical or emotional abuse, financial exploitation, or neglect. To get help or report elder abuse, call your local area agency on aging or Adult Protective Services at 1-844-277-9300.
Did you just text me?
I didn't want to disturb you if you were sleeping.
Sleeping? I'm sitting right next to you, silly.
There you are. Hey, I found a couple of Medicare helping programs online that I think we ought to look into.
It says if we qualify, we can get help paying for our prescription drugs. Oh, and there's a program that can help pay our Part B premium.
To learn more about extra help and Medicare savings programs, call your local SHIP counselor today.
Maybe I better text him.
I was angry and upset when the doctor told me I have diabetes. I just didn't want to deal with it, the needles and the diet restrictions. But after I started to learn about it, those feelings changed. I was at risk for a heart attack caused by high blood sugar. That got my attention. I started watching my diet and making sure I got enough exercise every day. I want to be around for my grandkids, and now that I know what to do, it seems like a small price to pay.
Ask your doctor about diabetes education or visit montana211.org.
Hi folks, welcome back to Aging Horizons. I'm your host Brian Lamore. We're talking about Medicare and You, which is the title of the Medicare handbook that you received in late 2021, but there are other resources that are available to you also. You know, you can go here first, maybe you can answer your own questions. And Kimmy, what are some of the other resources that are available for our seniors to better understand or to check out what Medicare is doing for them?
Well, I first want to echo your praise of the Medicare and You book, because I think that publication, you know, I worked in Medicare for about 20 years, and that book just got better and better and better. And, you know, there's some things they don't put into that publication because they just don't know it when it comes out. So you can't get frustrated, because what else is in there is just really good, easy to understand explanations of things, so that when you do get your medical benefits, your health benefits, as you've said a number of times, you get the adequate benefits that you deserve to get, that you've worked your life for, that you've worked in your community for, and that they're all coming to you in the way that they should be through the Medicare system.
And the way you understand it.
Exactly, yeah, exactly. So, you know, it's an old joke that I've been using for about 20 years, but don't put your coffee cups on it. It's a book you should keep in your drawer, maybe with your phone book or something like that, that you can look at for a little bit of, you know, information or reassurance if you're trying to. And if you can't find what you need in there, then you go to the next step, okay, which is, well, there's a couple. You can go to the Medicare.gov website. Very, very user-friendly. You can make your own secure account there that keeps your information, and it's secure. Nobody can get to it but you or someone that you tell can use it, because it's password protected. And you can go there to look at whatever you don't understand. It's a very robust website with many pieces and parts that you can read about or pull up to explain. If you don't want to use that, but you still need questions answered, call your SHIP counselor. Call your SHIP counselor. That person is in your local community, probably. We have a number of these advocates, Medicare advocates around the state, and we cover every county. So we want to make sure that you call into that 1-800 number, you ask for a SHIP counselor, and they're gonna give you a hand on whatever you don't understand. And if you don't know and they can't find it, they will go upstairs and try to find it there. So, I mean, you know, as you said, one-stop shop. If you can't get the answer, we're going to find out for you.
That's right.
And so there you go.
Yeah. Well, you know, I've been working in aging, in the office 26 years, maybe another 10 years doing this, and we see seniors, and as they get older, they might not be really confident in what they're doing. And, you know, maybe a daughter, a son, maybe a nephew, maybe your accountant or an attorney, or maybe the neighbor next door who's always been very helpful. They can help you too, and let them know about these resources, right?
Yeah, absolutely. Because I think, you know, once you get onto Medicare, in most cases, you're on a fixed income and not a lot of extras coming in.
Yeah.
And for that matter, you might lose something if something extra does come in.
Yes.
So these helping programs, the low income subsidy, the Medicare savings program, Big SkyRx, dual Medicare and Medicaid. These are programs that are put in place to give you a hand up. And we don't want folks to suffer, to not take their medication, to not eat, to not have heat in their home. We want to help wherever we can. We have completely confidential staff that will not talk about anything that you've told them with anyone else unless you have given them permission.
Right.
They can help you, as we talked about earlier, those helping programs. You can sign up for those anytime. There's no big, strange, open enrollment for that. It's so you haven't lost any time. Get on it, and again, hand up, not a handout. Use the website if you think, if you're computer savvy and that's good for you, feel free. But if you don't want to do that, call. Call the SHIP counselors, and they will help you out and talk you through whatever.
So right now in January 2022, you might want to evaluate your plans that you signed up for. And my experience is make sure they know that you signed up, and then track what your expenses are, right?
Yeah, absolutely. And that'll help you in 2023. That'll help you decide, well, gosh, I love this plan when I got on it 5 years ago, but it's just gotten way too expensive. Maybe I'll take this other plan. And if you know the black and white numbers of it, it's a lot easier to pick that different plan.
Now, if you didn't re-sign up for your old plan or get a new plan, do they just drop you out?
No, if you're in a plan
in
2021 and you just did nothing, you will roll over into that company's next year plan, or they also you could run into the company not having that program anymore. And that could be difficult. So if you're in that position, call a SHIP counselor.
Call a SHIP person. I mean, even if you have some questions with what your bill is, you're questioning it. Was I there? Did they actually do that? They can help you out. Well, Kimmy, thank you so much for coming on, and it's always fun talking with you.
I had to be here anyway.
And I learn a lot every time I come.
It's always good to have you.
Great. And for our viewers, again, the SHIP counselors are a great resource, not only for Medicare, possibly Medicaid, but they also have access to our Area Agency on Aging programs, Social Security questions, boy, you name it, they can help you with it. So give them a call. For Aging Horizons, I'm Brian Lamore. Thank you for joining us.
Special thanks to the Department of Public Health and Human Services for their continued support. Hosts on Aging Horizons are program specialists at the Montana Office on Aging. Production facilities provided by Video Express Productions. For more information about Aging Horizons, call the Department of Public Health and Human Services toll-free at 800-332-2272.